I thank the Senator from Oklahoma.
Wisconsin.
Yes, Madam President. I came down to the floor here today to voice my support for the Cruz Amendment. I'd like to really concentrate on the cost of the health care law, which is why we're asking in this amendment to defund that bill, because we simply can't afford it. You know, so much of our budget already is not considered, and frequently in negotiations on how we stabilize our deficit and our debt situation, that's off the table. You know, things like Medicare, Social Security, as unsustainable as those programs are just off the table in terms of negotiation. But if you really want to take a look at the real problem with the health care law, about Obamacare, is the fact that it simply is not affordable. I know in the name of the bill it says the Affordable Care Act, but we simply can't afford it. You know, Basic Economics 101 describes the problem, because Obamacare will dramatically increase the demand for health care. 30 million more Americans, and let's face it, we all want those Americans to have access to affordable health care, will be accessing health care, or trying to, demanding health care through some kind of program like a Medicaid program, while at the same time the supply will be dramatically reduced. I mean, that's going to be an economic disaster. What I'd like to do is put up a couple charts and graphs here showing the true cost. We don't really talk about the true budget window. When Obamacare fully kicks in the year 2016, this is based off a CBO estimate, and all we've had to do is extrapolate the final 3 years. But basically what it shows is that Obamacare won't cost $1 trillion it was originally estimated to cost when it's fully implemented. Between 2016 and 2025, it'll actually cost $2.4 trillion at a minimum. And of course, it will be paid for by these taxes, fees, and penalties, which I guess now are taxes, equaling about $1.4 trillion. So again, you have $2.4 trillion worth of costs, you have $1 trillion worth of taxes, and by the way, the majority of those, or a lot of those taxes, a great portion of that will be indirect on middle-income Americans. That leaves about $1 trillion hole. Now, in the current budget window, that's the $716 billion that apparently is going to be taken out of Medicare providers. We're not quite sure what's going to be happening in the full budget window. That's $1 trillion deficit risk. And again, these are all estimates, which I would argue in general the federal government's not particularly good at estimating anything. You know, back when they first passed Medicare, back in the mid-'60s, they projected out 25 years and said that Medicare would cost $12 trillion in 1990. In fact, it cost $110 trillion, over 9 times the original estimate. And I don't believe the federal government's got even better at estimating in that intervening time period. As a matter of fact, President Obama famously, repeatedly said that if you pass a health care law, by the end of his first terms, the cost of a family plan would actually decline by $2,500. But unfortunately, that guarantee has not come true. Back when President Obama took office, the annual cost of a family plan was a little over $12,000. If his promise had come true, we'd be looking at a family plan costing about $10,000 today. But in fact, the cost of a family plan today is now $15,000. Again, that's somewhat of a broken promise. But if you really want to take a look at what I think is the greatest risk in terms of the cost projections by the CBO, is in that estimate of the total cost of Obamacare, the $2.4 trillion we're talking about in the true budget window, the CBO estimated only 1 million people net would lose their employer-sponsored care and get dumped in the exchanges with the subsidies. But it's going to be far, far worse than that. 160 to 180 million Americans access their health care through their employers. And I was one of those employers. I purchased health care for more than 31 years. The decision that employers are going to be making in terms of whether or not to carry health care is dramatically changed under the health care law. Now the decision is going to be, do I pay $15,000 for a family plan and then try and comply with now 20,000 pages of law, rules, and regulations? Leader McConnell printed out those 20,000 pages. You can see it in the hallway. It's an enormous burden for anybody trying to comply with that. But anyway, the decision is, do I pay $15,000, try and comply with $20,000 worth or 20,000 pages of rules and regulations, or do I pay the $2,000 and $3,000 fine, the penalty? And in so doing, I'm not exposing my employees to financial ruin. I'm making them eligible for huge subsidies in the exchange. If you have median household income of $64,000, you will be eligible for $10,000 in those exchanges. $10,000 worth of subsidy. Who isn't going to take that deal? And that's my point, is employers will drop coverage. They are incentivized to do so. And so rather than 1 million Americans losing their employer-sponsored care and enjoying those subsidies, tens of millions. And so one of the amendments I'll be offering in this budget process will be asking the CBO to provide the worst-case scenario. What happens if the McKinsey study is true, 30% of employers drop coverage, or 50 or 100%? It'll be a simple amendment to get the worst-case scenario. And with that, I yield the floor, Madam President.